Good morning. We're going to teach NGTube insertion to a parent who has to bring their child home on NGTube feedings. Hello.
Hi, Mrs. Greenwood. How are you?
I'm good. How are you?
Good. I'm going to be the nurse today that shows you how to put the tube in and check for placement and all that good stuff before you take Sophia home. Okay. All right. You excited?
No. I'm a little nervous.
Excited about going home?
Yes.
Okay.
Very excited about that.
All right. Good. So we'll make this a non-nervous procedure for you.
Okay.
Okay. So I kind of brought all the supplies in. Let me just kind of tell you what we're using.
Okay.
I have tape. We're going to tape the NGTube down. Here's the NGTube itself.
Okay.
There's numbers on it, so you're going to kind of know what number you need to go to when you put it in. Okay. We have these little tegaderms that we cut into little strips, so we're going to put that over the tube on her cheek to hold it in place. Some syringes to make sure that the tube's in the right spot. pH paper to check that it's actually stomach contents that we're checking.
Okay.
And then we have gloves here in the hospital that we're going to use. At home you're probably not going to use them, which is perfectly fine. And then we have a little bit of lubricant that we're going to put on the tube just to make it go in a little bit easier.
Okay.
Okay, so first thing we're going to wash our hands. And then I'll do the tube first, and then I'll have you do it as well, just so you're comfortable and you know how the feeling is and everything, and you're ready to go. So we'll get our tape ready. I like to do a little mustache to keep it in place, so we're going to kind of just make a little strip of tape. We can hang it here so it's ready. I'll do two just in case. Sometimes the first piece doesn't work out.
Okay.
Gets folded or whatever. I always like to be over prepared. Okay, so check our placement first. So when you check placement, we're going to go from the tip of the nose to the earlobe, and then we're going to kind of go in between the belly button and the breastbone. So I would say about a 31 on this side. It may be different on the other side, but I'm going to use this nostril, so we'll go to 31. And then I'm going to put a little bit of piece of tape on this as well, so we know where we're going to go to, and then you'll always know if you're in the right spot too once the tube's in. So I'll put a little piece of tape right around 31. Okay. So we know we're measured, ready to go. Alright. So when we put it in, we're going to kind of lift her head up and spray that, make sure it's nice. Okay, so she's going to start to cry. That's normal. We're going to put the tube in, and while she's crying, it's not going to advance. So once she stops crying and take a breath, we're going to continue to go and push the tube in. Okay? And we're going to angle it towards the ear a little bit. It seems to go in a little better that way. Okay, so we have it started, and here she's crying, so it's not going in. She's taking her breath, and I'm just going to advance until we get to 31. I gotta fix my piece of tape there. Okay, good. Okay, you can lay her down. Good job. Okay. So now, you want to hold it in place for me? I'm going to take these off so we can tape. Okay. So with the tape, we're going to go around the tube here and go this way and tape it over and go that way. So it kind of looks like a little mustache. Okay? And then we're going to tape it down on the cheek here with the tegaderm, but I want to check the placement first before we retape everything.
Okay.
Make sure we're in the right spot. So we're going to take our syringe. I'm going to pull back any stomach contents. We're going to kind of just put it on here. And then draw back. And she's got about 5 mLs left in her stomach, which is just fine. And I'm going to unscrew it. So now I'm going to take my paper, and I'm going to put a little bit of the stomach contents on the paper. And when it turns colors, we're going to compare with our chart. Stomach contents are fine between a 0 and 5. We know we're safe. And this is about between a 3 and a 4. So we're in the right spot, okay? Whatever we have left in the syringe, we're going to put back in her stomach. So we can just push it back in, and that's it. So now we'll do our tegaderm. And kind of just put this right over that tube. You gotta be careful because it likes to fold over on itself. I like to cut it with paper on there still, so it makes it a lot easier just to peel the paper off.
Okay.
And that should probably be pretty good. And just push it down. Okay, and we're ready to go. So when we're feeding Sophia and you have the bag hooked up to the end of your tube, you're always going to want her to be sitting in at least a 45-degree angle, because if she did vomit for some reason, you don't want it to come back or swallow it or go into her lung.
Okay.
Okay? So if you have to change her diaper or anything while she's eating and you have to lay her flat, just stop your feed momentarily, change her, and then sit her back up and start the pump again. Okay? So I'm going to have you take it out. You can untape her, and then I'm going to have you put her tube in.
Okay. We're almost done.
Great
One more.
job. Okay. So
I'm going to wash my hands first. And then, because we're here in the hospital, we have to wear gloves, but I probably won't at home.
Right. I'm going to cut you, or get you a new strip too here.
Okay.
Alright, so when you take it out, we're going to untape everything. Oh, you want me to untape it for you? Since you have the gloves, you got it. Okay, and just pull it right out.
Fast or slow?
You can go just normal, that's perfect, just like that.
Good job.
Alright, okay, so I'm going to take everything off of here for you, and I'm going to have you measure it now. And I'll have you do the other nostril just because we already put it in this one and it'll probably be irritated a little bit, okay?
Okay.
So at home you can alternate, you know, if you have to change it for some reason or one nostril's getting irritated, you can just, you know, take it out or retape it even on the other side if her cheek's getting irritated.
Okay.
Okay? And one more little piece off here. Alright.
So, I'm going to measure the tip of the tube from her nose to her earlobe, and then from her earlobe midway between her breastbone and her belly button.
Yes.
So about 32.
Okay. Very good. Let me get you a little piece. Wrap it right around 32. Okay. There you go.
So I know 32 is as far in as I want to go with the tube because that'll be in her stomach.
Yes.
Okay. And then I'm going to take the lubricant, which I probably have KY at home.
Perfect. Any water soluble.
Water soluble?
Yeah,
okay.
is what you want to use.
And, okay, last time, baby.
Alright, so you're
Alright,
going
so
to
I'm going to lift her up,
Mhm.
hold her head, and I'm going to go in through the nostril.
Yes.
She's crying. She's crying. Okay, she took a breath, and then I'm going to keep feeding it in until I reach my taped mark.
Yes. Perfect. Okay. So do you want to, I'll hold this. You can take your gloves off if you want.
Okay.
And then I'll have you tape it.
And we're going to mustache tape it.
Yeah.
Which means we'll put the piece of tape sticky side up underneath and then wrap one side around on one cheek and wrap the other side. Make sure she can breathe.
Yep. Perfect.
Okay.
And this is really nice and secure. It's not going anywhere, which is what we want.
And then we want to test to make sure it's in the right spot before we totally tape it down.
Yes. I think that's a good choice.
And I'm going to take my syringe and hook it up to the end and pull back. Which she is about 5. Take that off. Then I'm going to come over here and I'm going to test with my pH paper, and I'm going to put a drop of stomach contents on that pH paper, and then I'm going to look and see kind of where it falls between a 3 and a 4.
Perfect.
And then I know I'm in the right area.
Yes.
And what do I do with this?
We're going to put it right back into the tube so she can get everything that should be in her stomach.
Okay. So you put it back in.
Perfect.
And unscrew. And next I'm going to use the Tegaderm
Yes.
to secure it to her cheek.
Yes. And if you didn't have Tegaderm, you could retape it too. You know, to her cheek, just put an extra piece of tape over. Or,
Okay.
but the Tegaderm's nice, it's clear, it just looks better. And then she doesn't have tape all over. It's not very comfortable.
Is it easier on her skin? What if she like breaks out?
So if she does start breaking out from the tape, we have something called Duoderm, and it's almost like a skin. It looks like skin. It's really gentle. You can cut a little piece, a circle or a little square, put it on her cheek, and then tape the tube onto that Tegaderm.
Okay.
So we have that option too. Usually they send you home with that as well.
Okay. Now what do I do if I have to give her medicine through her?
So medicine's going to go through the tube just like her feedings.
Okay.
Once you put the medicine in, we're going to actually, I'll have you do a little flush.
Okay.
Because you want to make sure that it's not sitting in the tube.
Okay.
And it actually is going into her stomach, okay? So, this is just water, sterile water. You can use regular water at home too. It's no big deal.
Okay.
And you want to get any air out. You don't want to be putting air in her stomach because that's going to cause gas. And then she'll be uncomfortable.
So, let's say she has to take 2 mils of
medicine. Okay, so say we put 2 mils of medicine in, okay? Now you're going to flush that. And you can see the medicine going through the tube because 2 milliliters isn't going to get through this whole tube. So now you have to flush the water all the way through.
Until it's clear.
Until it's clear,
tube.
yeah.
Okay.
And you can kind of gauge, you know, how, I would say at least 5-10 mLs at a time. Do a 10 ml flush in between. And then you'll know that the medicine's in there and she's getting what she needs.
Okay.
And same thing after feeding too. Flush the tube just so that the milk doesn't sit in the tube and get yucky and discolored and everything. Alright, do you have any other questions?
I don't.
Okay.
What should I do with this? Just tape it to her?
You can tuck it in her shirt if you want. If it's longer, you can just kind of wrap it up, tuck it in the diaper tape, and it'll keep it nice and secure. Just kind of tuck it in.
Okay.
Alright, great job, Sophia, and you did a great job too.
Thank you.
Thank you.